science is now heading in this direction is about stem cells.
Yes, this is a very important thing to know that although oxygen is very essential for us to live, for the millions of cells to live, at the same time, hypoxia is essential for the survival of stem cells. Stem cells do not tolerate the level of oxygen that is prevalent in our blood. That is why during embryonic life, when we have a very low oxygen saturation in the blood, you know what? In the mother's womb, we get oxygen only as much is available at the Mount Everest. So very low concentrations are available when we are in the mother's womb. At that time, the stem cells circulate freely in the blood. Then what happens after birth? After birth, when we breathe the atmospheric air, the oxygen concentration suddenly goes up in the blood and the stem cells, they run away. They have to hide themselves in what we call as the niche, particular place in the bone marrow, where they stay surrounded by other cells. The oxygen is diffused from the outer side. The other cells consume the oxygen and the stem cell survives in the center. But they cannot circulate freely in the bloodstream.
Wow.
That is the reason why these days stem cell banking is very much a thing of current discussion.
That's right.
When a child is born, the newborn, we try to take a small sample of blood from the umbilical cord, and that cord blood is stored in deep freeze for future use. Although we are not sure what we are going to do of the stem cells, because to culture the stem cells, it is very difficult. And then again, culturing the stem cells requires very low oxygen concentration.
Yes.
While the atmospheric concentration is about 20%, stem cells survive and stem cells multiply in 2% oxygen. So now what is happening is, the stem cell researchers, they are trying to regenerate, say for example, they are trying to regenerate the coronary blood vessel or maybe the cartilage of the knee. So what they will do? They harvest the stem cells from the bone marrow from various sites, and then they inject those stem cells to the place where the repair has to be done. For example, in the knee. So my question is, why you need to take stem cells from here and inject somewhere else? While all the body parts are connected through a meticulous network of blood vessels, why the stem cells can't travel? Any other cell can travel from one place to the other. The blood cells are traveling. Even the cancer cells are traveling. So why do the stem cells not travel? The answer is oxygen. The prevalent level of oxygen that is there in the blood, it disallows, it does not allow the stem cells to go from one place to the other. It's like a curfew imposed on the roads.
Yes.
Where you cannot go and buy your daily needs. You cannot go out because there is police everywhere. Only if you relax that curfew for say 15 minutes, you will go and purchase your daily needs, the milk packets and the veggies and the fruit, and come back. 15 minutes is good enough for you. In a similar way, 3 minutes are good enough for the stem cells to travel from one place to the other, because the whole body circulation time is about 1 minute. 3 minutes are good enough, which we can produce with the practice of Nishesha Rechak Pranayama.
Amazing.